Thank you for staying with us. We'll now link up with Eshomo Moimudu and TJ Suadeoye in our Abuja studio for FCT Brief. Good morning, guys. Over to you now.
Good morning, Veronica. It's good to hear from you this morning.
Yeah, good morning, Veronica, and good morning, colleagues over there. Good to hear from you today. Now, TJ, something happened on social media. It's a video on social media that's very troubling, and it has to do with our health institution. I think it's the Federal Medical Center in Abuja today, but it is typical of a lot of our public health facilities across the country.
Of course, that's not the first time we're seeing something like that. Very recent, we saw a man who says he took his pregnant wife to the hospital and he was not attended to because he was not able to provide 500,000 naira. Also, we saw some times back in Maitama here in Abuja where a lady was taken to the hospital after suffering gunshot wounds and, you know, they were demanding for police report. I don't know what processes that applies to emergencies in the hospitals, but I think in Nigeria now we need to be putting that in focus because a lot of lives have been lost in this regard. You know, they demand for very frivolous things that you can just ordinarily treat the patient.
Exactly.
And then after that you can, I think saving life first should be priority for this medical facility.
Exactly. And my worry is we used to have what they call Savicom. And I think as at now, Savicom is dead in most of our civil services and public health institutions. You don't have Savicom where you can easily go and lodge some serious complaint and it is treated.
Yeah, I think that's one of the issues we face here in Nigeria. It's easy for us to set up agencies or, you know, put in some kind of task force, but how effective are those, you know, task force or those facilities you put in place to monitor, you know, because putting people under surveillance is one critical aspect of, you know, tackling this kind of challenge. And again, the negligence we see among some of these healthcare practitioners, you can't put it far from how long are their working hours? Exactly. What are they being paid? Exactly. Sometimes someone can just be paid something like a peanut and they don't feel the need to, you know, take their job seriously. So that also
if the kitchen is too hot, get out of that place.
The welfare of the healthcare workers also need to be put into consideration.
Now let's give you what we have to do now. Good morning, Nigeria. Welcome to FCT Brief, coming to you live from our studio here in Abuja. Now today we will be looking at the men and women who form the backbone of our healthcare system, from doctors and nurses to lab technicians, community health workers, and support staff. From emergency rooms to rural clinics, healthcare workers are often the first line of defense in the fight against disease and the last hope for millions in need of care. But beyond their medical duties, many also play the role of counselors, educators, and advocates for patients' rights.
But despite their dedication, healthcare workers often face enormous pressure, including long hours, inadequate facilities, and safety risks. Not just that, for instance, health workers sometimes are trapped over what decision to make when emergency victims are brought to the hospital. Instead of treating or stabilizing the patient, some hospitals will insist on payment before attending to the injured patient. For victims of gunshot, they will be demanding for police report rather than saving the life first. These practices have been on for a while in Nigeria, and it is a source of concern to many Nigerians. For further understanding of the dealings and practices of medical practitioners on duty in our healthcare facilities, let's bring in the pioneer provost of the College of Health Sciences, Federal University of Lokoja, and a former President of the Nigerian Medical Association, Professor Mike Ogirima, and he joins us via Zoom. It's good to have you on the program this morning, Professor.
Good morning, Nigerians.
Good morning. Well, let's jump straight into the issue. The incident at the Federal Medical Center in Jabi has once again raised questions about our medical profession. Some are concerned about how accountable and how professionality is gradually sliding out of our healthcare system. I would like to ask you, who should actually be held responsible for making sure doctors and nurses are doing their jobs the right way?
Thank you. The policies and the legal framework are there. the officers in charge are definitely at any hospital is the medical director or the chief medical director, as the case may be. Of course, that officer alone cannot co-descend to various units of the hospital. So in an accident and emergency unit or department, the head of that unit should be held responsible. Of course, bearing in mind that emergency preparedness involves not only the personnel, the head human resource, but the system as a whole. So, there must be an officer who, on 24-hour basis, supervises the department.
Okay, Prof. What just happened definitely is not a one-off. It's something that we are used to. And for anyone to claim ignorance that it's happening in our health institutions, the person may just be economical with the truth. Why is it taking us this long, especially when we talk about dealing with emergencies? If something is called an emergency, what qualifies somebody to work in that department of a health institution?
Thank you. A well-trained team is expected to be on ground. That means the team should comprise a well-trained porter who knows that, a patient being driven to an emergency center needs to be moved from that vehicle to the point of triage, if there are many. Sorting them out, and that means the next person that should be on ground is the nurse and the doctor. So if the porter is there that has moved the patient right from the ambulance or the vehicle, gets the patient on trolley or on wheelchair to the point of sorting them out into the levels of injury, critical, urgent, then the nurse on duty with the doctor, the medical officer on duty, attends to the patient. The policies are there guiding what to do, what to use, and who to use them. At the emergency situation, at the emergency unit, the gadgets are there. I assume they should be functional. Of course, in the video, we could hear somebody complaining there's no glove. But I know that we should look at the attitude. I always tell whoever cares to hear that medical service, the call to medical service is divine. If you are not called, don't force yourself into that area. You should have empathy. You should be well equipped with the gadgets that are necessary to save life. And above all, that person must be well motivated.
All right, Prof. Just like my colleague said earlier, it's not the first time we are seeing cases like this, especially in that FMC Jabi. Will it be safe to say that government hospitals are not well managed or supervised as the private ones?
The government hospitals are well supervised, as I have outlined earlier on. The chief medical director is there. He has his subordinates. Incidentally, very sad enough, Federal Medical Center Jabi is a flagship center. It's a center that is in our hearts as medical practitioners because of the strides they have achieved there. So it may boil down to the attitude of the workers. Because the policies are there. Even if you bring a gunshot patient, or somebody is wounded from a robbery scene, attend to the patient, save the life of that patient first before you start asking for legal documents to cover you.
Now, Prof, let's take a critical look of public health institution vis-a-vis the private health institution. In the private, most times you have different layers of supervision. You have the medical director, you have different layers of supervision. But in the public, you may not have, or we do not have such layers of supervision. So you have an instance where, for instance, the chief medical director does not have the capacity to immediately supervise those subordinate to him or her, like we saw in that particular video. Don't you think there should be a kind of a reform where proper supervision, not just saying we have a chief medical director there, but different layers of supervision should be in place, not the ideal situation that we've never been able to attain, but in practice, how can we have efficient public service? Not like the one in the civil service, not like the ones we have in the public institutions. That will be efficient like a commercial and private entity.
Good. We've been talking about reforms. And I'm happy the present administration keyed into it. There's a lot of initiatives that are ongoing. However, when you talk of services at any hospital, there are various levels of, schedules and supervisions. At accident and emergency unit, 24 hours, there must be a supervising casualty officer who is a doctor. This person is well trained to handle emergency and to handle the team. The nurse is part of the team. The medical lab scientist is part of that team. The porter, we should not neglect the lowest person in that team.
All right,
the
Prof.
porter.
All right, Prof. I'd like you to just hold your thoughts.
Trained and well orientated.
I'd like you to hold your thoughts. We'll come back to that, but that'll be right after this short commercial break. Don't go anywhere. We'll still have more for you. We're glad to have you back. This is FCT Brief, and we're still discussing medical emergencies, and we'll still have with us Professor Mike Ugirima. Now, Professor Mike, you were saying something. Would you like to continue, or should I go ahead with another question?
With another
question.
All right. FMC, after the incident, they had a briefing yesterday, and they said they have feedback systems in place with QR codes and helplines available to patients. But how effective are these feedback systems, and do the patients even know that this is in place? All right, we seem to have lost connection there, but we'll get back to that. Now, this is what FMC is saying, that their QR codes, I believe they are feedback systems, but I'm sure even some of the patients don't know that is in place, because if that person that made that video, I think 2 days ago, had known, I'm sure he would have tabled that to the appropriate authorities. But I'm sure that many of these patients don't know, and how effective is it even working in the first place?
Even a critical look at the press statement, it's so faulty in so many ways. The entire press statement did not even say anything about the condition of the patient. Yeah, the guy explained to journalists, but in the statement he released, he didn't even say anything about the patient. All he was concerned was the image of his institution. Who cares about the image of the institution? We're talking about the life of a citizen. You're talking about the image of an institution. Now, I think one of the reforms that may be necessary, not just in hospitals, in public facilities, is for us to have cameras in place. The lady was protesting when the camera zoomed on her. If we have cameras in place, I think it will help us. Cameras that are working, that we can always go back to see what happened in the course of the day.
All right, Mr. Ugirima, I hear that you're back now. I was asking you that the FMC, in their own response to what has happened, say that there are feedback systems in place like QR codes where patients can actually, give feedback if they are dissatisfied with services in the facility. Now, how effective is that feedback system, and do the patients actually know that this is in place?
Prof.
Mr. Ogirima.
A bit of a challenge there.
All right.
So we're just saying that, look, going forward, we have to move forward. And one efficient way, I also know that there's a particular bank, I won't mention the name in those days, that had hired people like mystery customers. And the mystery customers were going from bank to bank. You won't know that they were sent by the MD, and they will come in as normal customers. And whatever happens, they give feedback directly to him. And a lot of people were dealt with that.
Mr. Ogirima.
Yeah, I'm with you.
Okay, did you hear my question, or I need to ask it again?
Yeah, I understand the question, that how effective those feedback mechanisms.
Yeah.
Yes, you may have all those gadgets there, which qualifies a center to be a center with medical legal environment. There must be officers who are in charge of those gadgets, monitor it 24 hours, and have a positive or a negative feedback. And our team manning the accident and emergency unit must be well trained. Drills must be on, frequently, so that they should be alert at any time. So where this is, absent in public setup, of course, the reflex will not be so sharp as to react to incidents. I am aware that some public institutions have frequent drills on emergency preparedness. Most, high-level private institutions do this from time to time. We should have this in our public institution. Frequent drills, simulation, and, good motivations of the staff, together with staff attitude. We all have ethics, for God's sake. We work with ethics of our profession. So, and one of those things that is common to all professionals is that you must be empathic. Treat a patient as if you are the one.
Okay. Now, okay. Go ahead, Prof.
So I expect that feedback mechanism must involve, changing staff attitude to work. Motivate them. But let me just add quickly. I have seen situations in some public hospitals where professionals go extra mile to help those patients, but at the end of the day, they are punished. Their salaries are deducted for allowing the patient to go without payment. Yet, the patients have been saved. So these are things that we should harmonize if we really want an efficient public health institution.
Okay, that brings me to another thing. The police will always government will always tell you that medical facilities should admit patients, even with gun wounds, and don't ask questions, treat first. You just said that there are instances where medical personnel went extra mile to save the life of a patient, only to be punished because the patient left without payment. Now, where do we draw the line? If I as a medical personnel will have to go by the oath of my practice and save the life, and I have to face the brunt of my organization because the patient refused or failed to carry his or her own responsibility, how do we draw the line for me to be motivated to save lives and risk my job? Or should the government have a way to compensate if such happens? I'd like you to help us in this. Prof.
We have emergency fund from the National Health Insurance Authority.
Okay.
There are emergency funds that should be used to attend to this type of patient. Of course, even in private hospitals, patients leave and, without settling their bills. There's nothing you can do about it. But the conscience is there. If policies are well streamlined, we should have enough funds to treat, these patients, these indigent patients.
Now, Prof, from your years of practice, have we had instances where this emergency fund is deployed to defray expenses hospitals incur by going the extra mile to help patients? Do you have cases where the government intervene with this emergency fund and pay it off?
Sure. Even in that Jabi center, I've had calls to refer patients there. And patients were treated. Emergency funds within the first 24 hours are utilized. However, there are still certain fraction of patients that will leave the institution without showing gratitude, without paying back. I am aware the funds are available, emergency funds are available. But what we are advocating for is that this fund must be well managed by authority who, from time to time, boost the stock in various health institutions. It should be well coordinated so that the attending hospital just submit bill and instantly it is replenished. Those funds is replenished, instantly. We shall get to that level. But for us now, I know there are centers who have activated that emergency fund, and it is working. Jabi is one of them.
All right, Prof. People are actually wondering that if things like this are happening in big facilities like FMC, what is now the state of smaller healthcare centers like the primary healthcare in the rural communities? Are they getting enough attention as they ought to?
About 8,000 primary healthcare centers have been reactivated by this administration within the last 2 years. What we are advocating for is not just reactivating. We must make them functional like other big hospitals. Unfortunately, there is still dearth in the number of hands that are available. Of course, the Japa syndrome is there. It cuts across all professionals. Do we have enough doctors that we can post to primary health care centers? There may not be enough. And if there are enough, are the local governments who are supposed to be directly in charge of primary health care centers ready or have capacity to employ a doctor to man each primary health care centers? These are issues. We should address these issues so that our primary health care centers will be functional as they are being attended to. Of course, we know that the level of care, the level of supervision by the local government, chairman.
Wow.
All right, Mr. Ogiri, I guess we lost connection with him there, but now we are talking about this happening in FMC or in the urban centers where, if I move to one hospital and I don't get educated, I can easily move to another place. But here in the rural communities where primary health care, we see a lot of maternal mortalities, we see a lot of children, dying. What is now the state of
the negligence will be huge there.
Well, okay, here we have Professor Bak. Can you continue from where you left off?
Yes, I said, unfortunately, when we have rehabilitated primary health care centers, we don't have enough hands to run them. And even where you have enough hands to run them, presenting them at the local government don't even have priority, health care priority as their program. So many doctors, many nurses are not encouraged to work in the primary healthcare centers.
Prof, you talked about not many hands to work in those health facilities. But every year we graduate students from our medical institutions, doctors, nurses, lab technicians. Is it that we don't have manpower that the schools are turning out, or we are failing in employing these people and engaging them? That is the problem.
It's multiple factors. In the last 5 years or so, 50% of what I churn out are outside the country. So if this is happening at one center, you could interpolate what is happening at other centers. So they are going. The doctors are going. The nurses are going.
So what of the 50% that are remaining? Are they employed?
Are leaving.
Prof, the 50% that have gone out, the 50% that are remaining, are they employed?
Yeah, the other 50% are put on locum. How can you be in your country and you are working as a locum officer for 2 years, 3 years, 4 years, 5 years?
Well, it's a good thing that you touched on this brain drain issue, because in 2023 alone, over 51 healthcare workers reportedly left FMC. That is Jabi alone. And this is replicated all over, other healthcare centers in Nigeria. What is actually being done, or can anything be done to reduce this rate of brain drain that we have currently in Nigeria? Because we, train a lot of hands. I believe that the universities and all these educational centers actually train these people well, but we lose them to other countries.
Yes, we should not waste time in employing them, engaging them. Two, most of them are leaving because they can't sustain their living. They can't sustain. How much are they being paid? And we are exposing them to risk. So if they have opportunity of going, they will go. It's a matter of who needs my service. Not caring of being patriotic to the country. For our own generations, we have said we are going to die in Nigeria.
But Prof, if you're saying this, just recently we saw an increase in budgetary allocation to healthcare. Are you saying that this did not take effect in any way?
It will take time for it to take effect. The immediate effect the health practitioner wants to see is his pocket. The pocket has to show alert. There should be an alert. I mean, a doctor who is working in Nigeria, for example, you are earning 200,000 naira per month. That same doctor, if he crosses to Europe or America, we are talking about 3 million or 4 million per month. Of course, the older generations have vowed to put in their best. But how long can we be stretched? At most.
Wow, I think we lost that connection there with our prof. What a way. I think something urgent must be done. Apart from saying declare emergency, I think we should move a step further. If 50, like Prof said, if 50% have jackpot, you have another 50%. What are you doing with the recruitment? The other time we had a guest here who said the problem is recruitment. And he also said, I think he mentioned the technical name. They're on the list for 2 years in your own country.
It's a good thing that we can identify where the challenge is. It's now left for the response from the government angle. If they are saying that I think welfare of the healthcare workers have always been a major issue that has been raised. So that should be looked into, and also engaging those that are, in need of this employment. Well, Professor, do you have any final words before we let you off? We've run out of time.
Yeah, I think, as I was saying, that the healthcare worker must be well motivated, just like other countries are pulling them from our shore.
All right.
Because the main reason why they are going is heavy pay compared to, the service they are rendering.
All right.
Our health workforce are trying their best, and kudos to them.
All right, we must say thank you so much for joining us on the program today. It was a delight speaking with you. Thank you.
Thank you.
Yeah.
Well, that's where we'll leave off the conversation today. We hope that real action will trail this kind of conversation, especially from government and all those involved. We'll now hand you over to our Lagos studio, where Veronica and the rest of the crew are standing by to continue with the rest of the show.
All right, thank you, Tijesu and Eshomomo, for that insightful interview.